Hi, I'm Dr. Deborah Furtado. One of the number one questions that my patients ask me about weight loss and weight loss medications is, are they safe? Well, in fact, the injectable weight loss medications, and a lot of people don't know this, have been around for years, dozens and dozens. We've been prescribing them for diabetics, and it really just come to light that they're excellent for weight loss and weight loss remedies because of the elements of that medication, how it acts on the body, and the side effects and the side effect profile, really, really important to people. So you say, well, what's going to happen to me if I take this weight loss medication? If I take this injectable, something like semaglutide or tirzepatide or some of the other name brand medications, it works for most people. They get really good results. And the most notable result that I think is amazing, and I've experienced myself, is the food noise. Food noise goes away. It just stops. You no longer obsess over eating or when to eat or how much to eat or what you can eat, and I think that's really compelling for people who have been on all these diets their entire life, and they've yo-yoed on and off, and they lose weight and they gain it back. And what they really never do is stop that sound in their head, and they're hungry all the time. That's a problem, because it drives you to want to continue to eat. Losing weight is important. Keeping it off is even more important. When you're on these medications, I think that the most important thing that you can do is watch what little calorie you actually need to survive and thrive. Okay, this is always, to me, about health and wellness, well-being, your health span, not just your lifespan, not just how long you can live, but how well you can live while you're living. You want to be healthy, you want vitality, you want strength, you want good sleep, you want less anxiety, you want to look better, you want to have endurance. Okay, so these medications can help with those things, at least retrain you so that you can learn a new lifestyle. It doesn't help that we are being bombarded with media and different advertisements that continue to draw us in and make us want their product. They've designed products for this unquenchable need to have them. So our body naturally has in the mind, satiety centers of the brain that recognize when you've eaten, recognize when you've slept well, recognize when you have the love of a good person with you, whether it's a child or a family member or a pet. It understands that, and there's a dopamine release in the brain. There's a feeling of completion. Okay, a lot of people who have eating problems or eat too much or overeat, they're looking for that feeling. They're not accomplishing it, and it drives or compels them to eat things that maybe aren't the healthiest for them or too much of it. But it's really not the person's fault. I mean, the research on this is becoming indisputable. I mean, losing weight is a big deal. It's something that everyone needs to stay healthy, because fat itself is toxic. Fat around the midsection, it causes problems. It gets integrated in your organs, and it increases inflammatory conditions. And fat cells themselves, we used to believe they were just benign, beige colored cells. We know they have kind of a mind of their own now. They're sort of in control. They really redirect you to do the things that you shouldn't be doing. You probably wouldn't do normally, but fat begets fat. It's terrible. It's terrible. So let's work together. There are some remedies, both food choices. There's always exercise, is always the bottom line, not smoking, drinking at small amounts. I mean, people love to have wines but you got to keep it reasonable, really. And, and then you look at these medication options, medical options, and I can help you with that. You have a great day. Stay young.